Hi everyone, my name is Rachel Ugranovsky. I'm a perinatal addictions prevention specialist at the Partnership for Maternal and Child Health of Northern New Jersey. Thank you so much for joining me today. I'd like to provide some guidance for those individuals that are trying to stop using alcohol and or other drugs, and for those individuals that have stopped, that are trying to build a support network. Now, support networks are usually created through the use of outside programs to include 12-step programs such as Alcoholics Anonymous, Narcotics Anonymous, and other programs as well. These meetings, as well as treatment, have usually been held in physical settings. Now, with the restrictions of COVID-19, we know that that's virtually impossible. While treatment centers are trying to make up for the gaps in access to services by utilizing virtual health and telehealth, we know that online meetings have been available for quite some time, but transition into virtual meetings has definitely taken over since COVID-19 in March of 2020. Now, a few things to remember when you log into these meetings is you want to identify yourself and connect with other people. That is the key component here. Social distancing doesn't have to mean social isolation. Connecting with others is the best thing that you can do for yourself and your recovery. So when you log in, there's usually a chat box. You can connect with other members or you can connect with the host. And especially if you're new, you want to ask a lot of questions. You want to get a sponsor. And in order to find out what a sponsor is, ask other members. They'll guide you to that. They'll guide you to literature that's available for you to read online because access is limited right now. The next thing is relapse triggers. Identify what they are. And if you're new, you're not going to be very well acquainted with some of the terminology. But relapse is nothing more than returning to using alcohol or drugs, which is something that everyone, whether you're new or have been in recovery, wants to avoid at all costs. So just keep yourself in a place where you're identifying what makes you feel restless, irritable, discontent, uncomfortable, anything that used to push you to use alcohol or drugs. And sometimes it can be nothing at all. That's why it's important to connect with other people in recovery on a regular basis. So the last thing is that make sure that you are regularly connecting with your provider for mental health or any other services that you have been involved with before this started. You want to try to keep everything as normal as possible. So just remember, you have connections with people at your fingertips. And so do the best that you can and utilize all of these resources, as everyone at the other end of the computer or the phone is more than happy and willing to help. I wish you the best and I thank you for joining me.